Morning guys. So the question is, why go on TRT, testosterone replacement therapy? Well, the answer is actually quite simple. It's because you need it. It's not because you want it. It's not because you think it might be a good idea. Shall I, shan't I? It's because you need it, okay? Testosterone deficiency syndrome is a medical condition. It's a pathology. So there are diagnostic criteria set out by rather clever people. There are British Society of Sexual Medicine guidelines that we should be adhering to, which ascribes symptoms of low testosterone and diagnostic blood tests. So we've discussed the shortcomings in the diagnostic blood tests, unfortunately, because obviously they don't take age into consideration. So it isn't quite as simple as saying just follow the BSSM guidelines, because there are compounding factors that need to be taken into consideration. However, there are diagnostic criteria which highlights the fact that it is a pathology and it's not something that should be entered into lightly. So, with regards what you should do, you should explore all avenues before considering testosterone replacement therapy. So your lifestyle issues that could be compounding your problems, your dietary issues, your exercise issues, all of these things should be taken into consideration and addressed before considering testosterone replacement therapy. On testosterone replacement therapy, they should also be addressed, because testosterone is not this utopian state where you don't need to look after yourself. You know, it is only part of the equation. It's a fundamental part and a very important part, but it's only part of the equation. It allows you to do what you need to do, and that's hopefully move forwards. So, testosterone, what is it? It is a synthetic compound. It is the same chemical structure as the testosterone you produce in your body. It is not bioidentical, as in not, it's natural. It's not taken from a human being. It's not taken from an animal. It's synthetic. It's made in a laboratory. So any claims to the contrary is absolute garbage. Scary stuff that I hear on the internet, my God. So, can we make this quite clear? Testosterone deficiency syndrome is a medical condition. It's a pathology. There are diagnostic criteria because it's a pathology. Testosterone replacement therapy is a medical treatment. It should not be entered into lightly. It's not like taking a multivitamin. This is a lifelong commitment. Testosterone suppresses the pituitary gland, and hence, if you decided to come off of it because it was a whim and you weren't properly you weren't worked up properly, and you realised actually TRT wasn't for you, then you're going to come unstuck. You know, there is the possibility that your pituitary will kickstart back in, but there are no guarantees. So it really is an incredibly important decision that you need to make. And it's a decision that should be made with a clinician that is experienced in hormone deficiencies. I'm not even going to bother saying it. So, you know, please think TRT can be life-changing, but it's not something to be entered into lightly. So what I'll do is I'll put a link to how to get TRT in the UK in the comments section, or the description section, sorry. It's not an advert for the clinic. You know, if you choose to come to the men's health clinic, I'd be delighted to see you if you have a deficiency. It is an independent guide for guys to access safe and effective care. This is not a sales pitch. I'm a medical doctor. I will treat a medical condition. I will not give you gear. You know, our whole aim of this is to normalize, and when I say normalize, I mean optimize, I mean make natural, to restore your androgen levels to within normal physiological parameters so that you can feel the benefits of testosterone replacement therapy and subsequent optimized male hormone levels. This is really quite important. So, yeah, please think, please do your research. Ta-da.